Sex is often thought of as the forgotten ADL because we tend to focus on skills that help with people's survival. For instance, we teach them bowel, bladder, getting dressed, transfers, and sexuality is often left out of that initial rehab.
When you have a spinal cord injury, your body works differently. There's two types of arousal that generally occur in people. There's arousal that comes from the brain and then goes down to the genital, and there's arousal that you have from being touched in the area of the genitals. After spinal cord injury, depending on where your level of injury is, one or other of the ways to have arousal might be affected. And actually, the way you have arousal is similar in both women and in men. The area between the pockets and the belly button, the more sensation a person has in that area to surface touch, the more likely there is that they can have the arousal coming from the brain down to the genitals. Most people with spinal cord injuries, as long as they don't have a very low level of injury, a very low paraplegia, where they don't have reflex bladder or bowel function, those are the only people that don't really have the reflex arousal.
For a male, they could have anything from erectile dysfunction to positioning and range of motion issues. For females, a lot of times their issues is mobility, range of motion, and lubrication.
Sex after spinal cord injury does have some risks. One risk is that if you are insensate, what you're going to need to do is pay attention. You don't want to just get down on the carpet and have sex for an hour the first time you're having sex after your spinal cord injury, because what's going to happen? You're going to get rug burns, you're going to have friction. So you want to be careful. Check your skin after you're sexually active. If you're using a new toy, you want to use it first and then check your skin and make sure it's safe for you. So you want to make sure there's no redness that doesn't go away. It might be that you want to use a lubricant that decreases friction. So these are important things to think of.
Spasticity is an abnormal response in your muscle tone. It happens for a lot of patients after a spinal cord injury. Sometimes it's unprovoked. It causes some people to have pain and others to just not even realize that their leg is spasming. For some people, it leads to balance issues. It could lead to falling.
So spasticity is actually a double-edged sword during sexual activity. One of the things that doctors do is give people a medication called baclofen and other medications to treat spasticity, and these medications can actually cause negative effects on arousal. They can cause problems with erection with men and arousal and orgasm with women. When you are sexually active, what happens is the more a person gets into the arousal phase and they're close to orgasm, they're going to get an increase in spasticity. And then as they get to the ejaculation or the orgasm phase, then the spasticity goes down. So it's very similar in people with spinal cord injuries to able-bodied people. Able-bodied people at the time of orgasm will have involuntary muscular contractions. And the same thing happens after spinal cord injury. But then once you get past the actual climax phase, the spasticity decreases. You might have to think a little bit about how you're positioning yourself because of spasticity.
You might want to speak to your therapist about what positions cause less spasms, whether it's that flex position. That might be the position you're aiming for when you do engage in intimacy. Some people do better when they're fully extended, and when they're extended, that might be a better setup for them as well. So you have to kind of use that spasm to your advantage if you can, or use medications and time your intercourse around that medication time.
Autonomic dysreflexia is an abnormal reflex of the autonomic nervous system that happens in people with spinal cord injuries at the level of T6 and above. So when you think about dysreflexia, you have to really take it into the context of what true dysreflexia is. People with spinal cord injuries, blood pressure goes up when they're having orgasms. So does everyone's. But in people with spinal cord injuries with the level of T6 and above, sometimes blood pressure can go up like very high and they'll get a headache when they're sexually active. Autonomic dysreflexia is a clinical syndrome where the blood pressure goes up and you feel that headache and you feel uncomfortable.
It's the body's abnormal response to a noxious stimuli, such as an ingrown toenail, a urinary tract infection. It's your body's way of telling you that something's not right. And what happens is your blood pressure goes sky high and you are at extreme risk of having a stroke. Some people can understand those symptoms that they might have, the blurry vision, the flushed face, and some people don't have any symptoms and it comes on rapidly. You have to be able to know how to manage it. Management of it is removing whatever that noxious stimuli is and sitting upright. So if you notice that you're lying down and you're not feeling so right, maybe clammy, sweaty, and you feel a little flush, you should try sitting up. And for some people, they have to catheterize. So for them, they might just catheterize and it goes away. For other people, if it's an infection or an ingrown toenail or something like that, it might require medical treatment.
This is a rare occurrence after spinal cord injury, so I don't think it's going to happen for most people, but they should be aware of it. And so if you are sexually active and your injury's at T6 or above, if you get a severe headache, you stop. You sit up. Generally, the headache's going to go away. If it doesn't go away, then you should see your doctor, find out what's been happening, and then you can get treatment for it to prevent it from happening again. So in terms of arousal, when someone's sexually active after spinal cord injury, the main thing is to participate, to enjoy yourself, to have fun, and just to kind of focus on what you're doing.